So gluten-free foods have increased in prominence in the US and worldwide in the past decade. In 2015, a Gallup poll reported that about a fifth of US consumers actively try to include gluten-free foods in their diet. This is an interesting food trend because we think, based on some very limited prior research, that the term gluten-free might confer a health halo. So a health halo is a term such as, low sodium, makes consumers, when they're looking at the package and they see that claim, think that the product is overall healthier. So we were interested in seeing how young adults valued gluten-free, and we really wanted to see how they valued gluten-free in relation to other things, such as whether or not they valued organic food or non-GMO or local food. And additionally, we wanted to see, are these people just health motivated? Are they sort of acting differently from people who aren't valuing gluten-free food? So we surveyed a group of about 1,800 young adults, and these young adults, ages 25 to 36, had initially been sampled as middle schoolers and high schoolers in the Minneapolis-St. Paul area. So our study found that valuing gluten-free food was most related to valuing organic, non-GMO, and locally grown food. One of the other things we found was that people who valued gluten-free food were also more likely to perform a range of other healthy practices. The one thing of concern was that many individuals who valued gluten-free were interested in weight control behaviors, and they were both more likely to perform healthy weight control behaviors, but then they also were more likely to perform unhealthy weight control behaviors. So because we found that people who valued gluten-free food sort of clustered on a number of different health behaviors and diet, this seems to suggest that people who are very motivated by health and nutrition are valuing gluten-free food as a part of that. Whether or not they need to include gluten-free foods or have some sort of gluten intolerance. So this sort of is in line with the health halo effect that we had hypothesized might be happening. So I think some of the take-home messages are, first, that eating gluten-free or gluten-free products isn't necessarily healthy, but it's also not necessarily bad. So we definitely want people to know that you should still check the package and sort of compare products to choose the healthiest product, and don't overly consider claims that a manufacturer might make.